What if the most important moments of your birth weren't fully explained to you?
What if how the system really works could change your outcome?
Well, you've come to the right place. Welcome to Season 4 of the Birth Squad podcast.
We're Dr. Ijama Bello and Dr. Kamisha Thomas. We are two OB-GYNs with over 20 years of combined experience, and this season, we're bringing you all the way inside of the delivery room.
In the past, we've amplified the voices of birth warriors.
But now this season, we're adding something different. Our unfiltered perspective as physicians who have seen it all.
We're pulling back the curtain on labor and delivery, the real decisions, the real dynamics, and what actually impacts your outcome.
This is your blueprint.
Welcome to Season 4 of the Birth Squad.
Okay, so let's walk you through a situation that we see all the time. You're in labor, you get to the hospital, and you hand your nurse a very detailed and thoughtful, I will admit, clearly put together birth plan.
And we're not talking about a one quick note here. This one is multiple pages. It's very specific. It has things there like no Pitocin, no epidural. You want delayed cord clamping, immediate skin to skin. And you've even thought about like the environment. You want the low lights, minimal interruptions, the whole experience.
You know, for a lot of people, maybe in the beginning, it's going according to plan. There's no issues. Everything is calm. You're settling in. But as we know, right, Ijama?
Yes, labor does what labor does. And it changes. Even as an OB, I am oftentimes surprised by what goes down. Things like maybe the labor is slowing down, or something comes up with the baby, like the heart rate is abnormal. And then suddenly, the situation isn't as straightforward as it was like even just 30 minutes ago.
And now we're making decisions suddenly, right? We're making decisions quickly. The team is adjusting. We're making calls in real time. And no one, unfortunately, is going line by line through that document that you spent all this time working on.
Right? That's really like the moment where maybe you start to feel like your birth plan is being ignored or even dismissed. Yeah. So let's talk about what's actually going on in this moment because it's often misunderstood. Most providers are not reading a very long, detailed birth plan while they're managing labor, just to be honest.
And, you know, I'll admit that that is the case for me. I was a former doula. I helped patients come up with birth plans. I advocate for birth plans. But even I have fallen into the habit where we're making quick decisions and we didn't have time to read your birth plan because sometimes I'm delivering someone who's not my patient. Other times I am delivering my patient and I just can't remember all the details of your birth plan. And it's because labor and delivery is fast paced, right? Things can shift quickly and all of us are trying to respond in real time. And we'll do our best to check in and say, hey, you know, what did you want to do about cord clamping? Or what did you want, a circumcision or not? But sometimes we don't get those moments.
Right. So, but what does really get through and what gets our attention is very clear, high priority preferences. So things that are easy to understand at first glance. And one thing to remember here is that like a birth plan is not a contract. It's a guide. It's not something that your health team is obligated to follow line by line. It's really a communication tool. It's a letter that's intending of what your preferences are, but it's there to help guide your team about what really matters to you, especially if things are going smoothly. So, you know, but when it's treated like a very fixed script, that's where, you know, things may not be bending as much.
So I'm going to say that again, right? I think what Ijama just said is really important. It's not a contract. It's a guide, right? The people who are going to be the most satisfied with their birth experience are the ones who are flexible. So let's get into that, right? Let's get into the expectations because this is where there can be a lot of tension. There's plenty of things that people include in their birth plan that is completely reasonable. And some of the things are what we already mentioned in this episode of our podcast, which is what a lot of hospitals already do. Most hospitals are going to be baby friendly. That means we value skin to skin. We want to have what we call the golden hour, which is immediate skin to skin with mom and baby for at least an hour. Most of us are going to do delayed cord clamping from 30 to 60 seconds. You just got to remind us if it's longer than that, because again, we're imperfect. We're not going to remember everything, but we are trained to try to provide you with the safest, best outcome that we can and still honor your experience.
But to be honest, there's some of the requests that truthfully, they cannot hold up in every situation. For example, someone saying, I want absolutely no intervention under any circumstances or no C-section, no matter what. Right. And I think the key thing is to remember what matters is a healthy baby and healthy mom. We all want that outcome. And sometimes a C-section might be the best route to achieve that outcome. So I think, labor is one of those things that it's kind of the first lesson in parenthood where sometimes you can't predict. I'll say oftentimes you can't predict what that baby's going to do. You might have that sleep schedule all together and then bam, they change something on you and now it's unpredictable. So I would say the same thing with labor. There's a lot of unpredictability that happens. So I think it's really important to have, flexibility because there are things that come up and it requires us to pivot.
I try to tell my patients to lean into the discomfort because we don't know what it's going to look like. We I also say a lot of times, I love surgery, right? We're a surgical subspecialty, but I want my patients to have a vaginal delivery because we know the benefits. We know it benefits baby. We know that it's lower risk, but we have it available to us as a tool when it's not possible because our goal is your safety and the baby's safety. So when we are met with that with rigidity, right? With the 6-page birth plan, it can really create tension before anything has really began. So instead of it feeling like helpful guidance, it starts to really feel like it's this point of contention or conflict. And
So
that
I
really
think it's really important to break down, communication and how it actually works when you're in the hospital, right? So usually the nurse is your main point of contact, right? They're the person who's going to be with you the most of the time. They're going to be at your bedside. And then you have the provider, the delivering provider. So that could be an OB or a midwife. And that person is the one that's like stepping in to make the medical decisions based on what is happening clinically in the moment. And then you have the whole system, right? The hospital in which you're in. So it's like, you have these people that live in a house, but they're not the rule makers of the whole house. They're just residents, right? So the hospital is a whole system that enforces, their safety protocols, their efficiency, their utility of rooms and instruments, and most importantly, also outcomes. That is their priority. So if you're,
so
yeah.
if you're so what I was going to say is if your preferences aren't clearly communicated or they seem really inflexible, they're going to be a little bit more difficult to incorporate in real time during the delivery process. And that is where those breakdowns can happen in communication, not because we don't care, but because the communication didn't occur in a way that felt reasonable or able for us to, proceed, like those when I always tell people we never want to use absolutes. We have these are our preferences. And I think the best thing you can put in a plan is to please communicate with me if the plan changes. I feel like that is the most important sentence that you can ever put in any part of your birth plan.
Yeah, so I think it's very important that you all hear this very clearly, right? The most effective birth plan is not the ones that are the longest or the most thorough. They are the ones that are clear, they're flexible, and they are prioritized based on what is really important to you. What are your very important preferences? Because labor does not follow a script, right?
Yeah, and your plan really can't. It shouldn't either. It really just is a guide. So what does that look like, right? Like what does that look like in practice? How do you actually create a birth plan that works within a system instead of against it? A lot of people will provide guides online. A lot of practices, a lot of hospitals will have sample birth plans. But I think for you, when you go into making it, you want to shift your mindset so that you're thinking less of it like a plan and more like a preference, which is the word that we've kind of used a lot during this podcast because we really want to emphasize that we're really just trying to help guide the process. One example is like I would like everything to be as low risk if everything is going well, right? And this is something I would like to accomplish. The other one that I mentioned right before was if the plan changes, please communicate with me what's going on, or before you give me a medication, or before you do an intervention, please discuss it with me. Please let me know what you're doing. I think these are things that really emphasize communication, and that you would like to have a process and a labor that is as informed and low risk as possible.
And I think the second thing to really keep in mind is, this is your birth, right? So this is the only thing that's happening for you. But you have to keep in mind that the people that are caring for you, they're also caring for a lot of other people too, right? So they are having to remember a lot of different things at one time. So when you have a plan, I think it's really important to just keep it short. Ideally, one page with bullet points, because, these people have very short attention spans sometimes, right? Or something is happening very quickly. And so you want that person to be able to just scan your birth plan really quickly and know exactly what it is that is important to you, right?
And talking about it with your provider ahead of time, they know the hospital, they know who's a part of their care team. So you can ask them during one of your appointments, is there anything that seems unrealistic in my birth plan? Some people might say, hey, I don't want an IV. And I'll say, I believe it's our hospital policy that we have to have an IV. We won't put anything through it, but we need IV access in case of an emergency. Is that okay? Right. So I think kind of setting that stage and preparing ahead of time is really going to help you create a birth plan that's going to be effective.
Absolutely. I think that's a really good point, right? Having those conversations beforehand so you're not having them in the labor room, right? And so when you have those conversations beforehand, really being open to feedback too, so you don't get surprised later. And then the other thing that we are huge advocates for is having a doula, right?
And use them strategically, right? A good doula is going to help translate your preferences in real time so that maybe you don't feel like you have to advocate for yourself, or if your partner is uncomfortable or your support person's uncomfortable, they don't have to support or advocate for you in real time. Your doula can advocate for you, and they can reinforce the things that matter without creating tension, hopefully. And a lot of us have worked with doulas. Always will give recommendation for doulas that know the hospital and know the practice where I work. And I think they really can act as a bridge between you and the clinical care team.
So at the end of the day, right, we're going to leave you with this. Birth plans themselves are not the problem, right?
I agree. It's unclear communication, and oftentimes unrealistic expectations.
Right. And so when a plan feels a little bit too rigid, that is where friction can be created.
So we want to help you understand that creating a plan that's a guide is important, that's clear and collaborative. Okay.
And the goal is not really to control every single moment, right? The goal is to make sure your voice is understood. And even when things don't go exactly as planned.
Because they won't, trust me. There's always going to be like a wrench in the plan that's going to be something that you didn't anticipate. And we want to know, we want to be able to support you when things shift.
Yep.
We want to know what matters to you.
Exactly. So again, it's your guide, and we're here to help you with this blueprint so that we can guide you through a safe and an effective and a beautiful birth.
All right. Thanks for listening, and we'll see you next time.